My name is Devin. I am a graduate research assistant, doctoral student with Dr. Ralph Halden, and we are with the Center for Environmental Health Engineering at the Biodesign Institute here at ASU. And I'm just going to provide some insight on my research towards my dissertation, but also it'll provide insight on what our center really does as a whole, which is wastewater-based epidemiology. And so what I do is I utilize this resource to understand basically dietary trends in a population. And I'm going to walk you through all of this and what this means throughout the presentation today. Oops. So my background is in nutrition and dietetics. It's what I have my Bachelor's of Science degree in. But I'm largely interested in, of course, nutrition, but also public health and epidemiology. So essentially, what it comes down to is I'm very interested in the connection between what we eat and how that relates to our health outcomes. And so after I graduated, I worked out in the field, and I also started a freelance company where basically I just was a nutritional counselor. I'm not a registered dietitian, but I am able to practice as a nutritionist. And I worked as a nutritional counselor at a local government agency where I would work with individuals and help them meet their goals. And what I actually observed are a number of different things, which I'm going to walk you through now. And first is what we like to refer to as basically the nutritional paradox. So across the board, we're seeing a lot of malnutrition, and this doesn't always have to mean starvation, but it also can mean we're not receiving the proper nutrients that we need in order to live a healthful and thriving life. And this can look differently on the outside to many people. We're seeing a lot of obesity as well as just general hunger amongst children and across the board in the adult population as well. We're also seeing a lot of food deserted areas, which lead to food insecurity. And what these two terms mean is a food desert can refer to basically a lack of access to the closest supermarket or market where you can get fresh produce, so fresh fruits and vegetables, again, which can provide the proper nutrients in order for you to live healthfully. And food insecurity can loosely be defined as you just don't know where your next meal is coming from. And what we see in these areas is also what we refer to as food swamps, where there is a very high density of fast food restaurants. And while many of them are making strides to provide more healthier options, such as maybe salads or maybe like fruit parfaits and things like that, those aren't necessarily the things that people are purchasing and subsequently consuming. So we're seeing large amounts of like overconsumption of fast foods rather than the foods that they probably should be eating. And it's a function of the environment that they're in. So if those foods were readily available, such as fruits and vegetables, would they be eating more of those than the other stuff that they tend to be eating? So we're seeing a large prevalence of these two situations here. We also have been observing for a very long time rising rates of obesity, which is considered largely a nutrition-related type of disorder. And obesity is a major risk factor for several diseases and disorders, such as type 2 diabetes, heart disease, and sleep apnea, which affects millions of people throughout the United States and costs our healthcare system and the people that are dealing with these diseases billions of dollars per year. Lastly, just sort of an added unfortunate feature with all of the different advertisements of the various diets that people can participate in or try, as well as all of the different types of labels that are out there. People I found in practice are just generally confused. They don't know what's right for them, and they don't know, if they purchase something that says maybe organic or non-GMO, is that truly what they are purchasing? And there's just a huge gap in information, which I always seek to try and reduce, and whether it's, if I'm working with a client individually or just in my research and what I'm doing here at ASU. So these are all of the things that I see as problems, and that what I've observed working in the field and still to this day as a researcher. So what are we doing to kind of counteract this right now? So in a clinical setting, we perform what's called a nutritional assessment, typically takes in the form of a 24-hour recall survey. So this gives us some insight into what an individual or maybe a small group of individuals may have consumed over the past 24 hours. And as you can imagine, this can be quite labor intensive, and we refer to survey bias can occur quite frequently. And what that means is generally recall bias. So if you ask me even what I ate for breakfast this morning, I probably would forget some things. Much of what this dietary form asks of the individual is, you know, how much of this certain food did you eat? What kind of oils did you cook with? What seasonings did you add? Did you use a cup or maybe a tablespoon or teaspoon? These are things that people just generally don't really know and don't really think about. So it's very difficult to get a solid answer from these surveys. While it does provide a qualitative assessment, kind of the what, we don't really get the how much. There's also food sales and food availability, which is you can receive from USDA, Economic Research Service. So you can get an understanding of what is leaving stores and what people are purchasing. But does this really give us an idea of consumption? Maybe I purchase a bunch of food for my grandmother every week, and that's not necessarily food that I am consuming myself. And my grandmother might live, you know, farther away from me. So while again, this is giving us a good idea of kind of the what, we're still not getting the how much, and how, and is taking it a step further, how that can relate to our health outcomes as a result of the foods that we're consuming. So we're left with a lot of questions in terms of public health. Are we getting the results that we need in order to, you know, set forth more targeted and more efficient strategies for improving public health? And perhaps we just need to think outside the box a little bit more. So enter in wastewater. And this is typically not the first thing that you think of when you want to understand what people are eating and how it relates to their health. But hopefully I can convince you by the end of this presentation here. So I'm going to first introduce the really big picture here, and I want to encourage you to think of a time that you were possibly at the doctor's office recently, or maybe not so recently. And typically they will ask for some sort of biological specimen in order to reach a robust diagnosis. So this could come in the form of a urine or a stool sample, also maybe even a blood sample or saliva. And again, this helps them understand what's going on inside in order to properly diagnose and then effectively treat whatever it is that might be ailing you. So now just the regular big picture when it comes to wastewater-based epidemiology, or more so referred to as WBE, we take that single person when you would typically be at the doctor's office, and we apply that to a population or a community. And same aspect in just that single urine sample, we are analyzing raw sewage that makes its way into a wastewater treatment plant. So when I say raw sewage, I mean it has not been treated whatsoever. And depending on the situation, we're either collecting a wastewater sample directly from the catchment system or the collection pipe, or at the entrance of the wastewater treatment plant, which would also be referred to as influent. So this can provide us community health information, because in that single wastewater sample, we are able to analyze for biomarkers that are indicative of various types of human behavior, whether that be consumption or use of various chemicals, things of that nature. This has a lot of benefits because it is anonymous. We are not able to identify one individual against the other. This is cost effective. So as you can imagine, just a single wastewater sample, we are analyzing an entire population instead of just one individualized test. And it can be considered in near real time in terms of turnaround time for results. So by the time I collect a sample, depending on what the compound or the biomarker of interest is, I could give back a result within a matter of days. Many traditional sources, especially in terms of nutrition-related data sources, could take maybe a year or 6 months, maybe in some cases biannually, in order to get a proper source of information. So that takes a lot of time. And when looking at it in terms of rapid feedback and making decisions off of that, that's not necessarily a good use of time there. So fast, anonymous, cost-effective. You could consider us doctors of the cities at that point. So briefly, just to touch on the sample analysis, we collect the samples, again, either at a wastewater treatment plant or within the sewer collection system or framework. We do perform a series of extractions, and then we run it through an instrument called liquid chromatography mass spectrometry. And then we do some calculations on the back end to end up with basically a mass per day per capita, whether it be per person or per 1,000 people, 10,000 people. It depends on what it is that you're analyzing for, but that is very generally what we are able to output as far as a result. And then we get something that looks a little bit like this. So I'm going to walk you through this graph. This is looking at 1-methylhistidine excretion. And 1-methylhistidine is a major biomarker or compound that humans excrete after we consume meat. Now, this is indicative of total meat, not just red meat or just poultry. This is meat as a whole. And if I were to eat, say, a chicken breast, I would then start to excrete 1-methylhistidine in my urine. And that's what this graph is showing here. This is from a very small population. This was, these are just some preliminary results testing out the methods here. And I probably should mention that in the field of wastewater-based epidemiology, no one has really taken on this approach before in terms of understanding dietary behavior or nutritional status using wastewater. So there's a lot of method development that needs to occur here. But these graphs show great promise. So this is from 2019, almost a full year ago, or basically a full year ago now. And we're seeing some trends over time here. Now it's only 2 months, so we definitely need to investigate further. But what we can do with this information is take a look at this and start to overlap it with other data sources, such as type 2 diabetes incidence or heart disease incidence in this same population. And we could start to make some broad conclusions or underlying assumptions between what people are eating as a whole and how that's impacting their health in terms of disease outcomes. So again, this is very preliminary, but these are exciting and promising results for more future study. That's what I've currently been working on over the course of the past year. It goes by fast. So why is this useful? Again, taking a look at the current methods in terms of understanding what people are eating, the dietary recall survey, and food sales and food availability, wastewater-based EPI or WBE could essentially fill in those gaps where we're just not seeing the connection. It gives us a population overview of what people are consuming. We can take a look at trends over time and then start to overlap that with our health outcomes. And then what we can do is take that a step further, use this source of information to inform the appropriate policymakers or decision makers within the community and say, hey, we're seeing large amounts of meat consumption and also large amounts of, say, type 2 diabetes. Perhaps we should start to form a more targeted approach within these hotspots and inform on appropriate ways to manage diabetes first and foremost, but also talk about meat consumption. This could also be useful in terms of environmental health. If we're seeing large amounts of meat consumption in particular while we're on this topic, it has been shown to leave a sort of negative impact on the environment, especially in terms of large-scale farming. So perhaps by getting this more in-depth overview and in-depth analysis of what people are actually consuming based on the robust quantitative measurements that we're seeing in wastewater through biomarkers, we're able to make some more broad conclusions there. So again, we're expanding the methods currently, and what I would like to see is maybe standardizing these methods and coming up with some public dashboards throughout, starting, maybe at the municipality level, and then broadening that to the state level. And that, again, can help to inform public health intervention and education strategies. So just some final remarks. I do want to touch on some other questions that were posed that I didn't necessarily address here. There was one that asked what my inspiration was in all of this, and hopefully the presentation made that somewhat clear, but maybe just to recap, I saw a lot of gaps out in the world when it comes to nutritional behavior and just general knowledge of nutrition and health in general. And I felt like there was something more that could be done in terms of the current methods. So when I came across wastewater-based epidemiology, I felt like that was the missing piece to the puzzle. And in terms of a piece of advice that I would give to a college student looking to go into a similar field, so again, I kind of can't commit to just one single field when it comes to this work. There are a lot of moving parts and a lot of different things to consider. But in terms of just maybe public health, I would definitely say to be open. There are a lot of different avenues that you can take, and maybe don't put all of your eggs in one basket. If you have a passion for something, go for it. And if it feels right, continue on. What would I look for in a job candidate? Someone who is, again, open and willing to learn new things, someone who is a self-starter and self-motivated. And then to talk about skills, especially important throughout my career. So far in my career as a graduate student, again, being a very self-motivated person, I think really works in my favor. And having my life experience and seeing what was actually observed out into the world, and now having a more targeted approach to my research and seeing that connection, I think is really helpful and really fruitful, especially in terms of looking at what I want to do in terms of my career once I earn my doctorate. And then the most rewarding aspect, so just public health in general is really rewarding to me when I know that I can help lots of people doing just one thing. This is more relevant currently with COVID-19. We are taking wastewater-based epidemiology and tracking SARS-CoV-2 in wastewater in various communities. And what we're doing is actually taking that information, giving it back to those communities and saying, hey, we're seeing spikes or maybe decreases in the virus in your community. And they are then taking that and coming up with new strategies to help either mitigate the virus or maybe continue what they're doing if the virus is at a low or maybe a non-concerning level. So that is probably the most rewarding, is knowing that I'm helping lots and lots of people kind of all at once. And it's actually leaving an impact. So I just like to acknowledge my center. So this is almost everyone at my research center here. Dr. Ralph Halden is my doctoral advisor. And I do want to mention Dr. Erin Driver, who is our research scientist with the group and is an instrumental part to all of this work. So I encourage everyone to please reach out if you have further questions. And that concludes my presentation for today.
Perfect, thank you so much. I was wondering, has this changed the way you see your own diet at all? Have you changed how you eat?
That's a great question. So as a nutrition student, I was actually, I was vegetarian and then vegan for a while. And, you learn a lot of stuff. You kind of are overwhelmed with the idea that the foods we eat actually leave a positive impact on your body, or negative impact depending on what it is. So I really took that to the extreme, and not saying that veganism is not good or not extreme, but it didn't work out for me. And so it's kind of an evolving process. I do incorporate most things into my diet, but I've learned, at least personally for me, that it's all about balance. And my research currently hasn't really swayed me either way, other than confirming that by eliminating any one piece of food, whether I like it or I don't like it, it's not beneficial all of the time, unless you actually have a condition where you have an allergic reaction or something. You don't want to eat that then.
Mm. That's interesting. Sam, do you have any questions?
Yes. So can you guys trace to see how, like I saw the organics chart versus like the wastewater. Can you guys see how much like GMOs are in the wastewater from eating non-organic
You
things?
know, it's not something that I've explored yet, but it is something that I've thought about. There are a lot of questions raised. I know people prior to me starting in this group here, we looked at pesticides in the wastewater and how that can kind of help determine, whether I think, or organically grown foods were being consumed in that area or not. So yes, it is something that I would like to explore, and I'm curious if that's something that we would be able to deduce from wastewater. There are a lot of environmental factors that are involved in that. We could just get general runoff depending on the area. It wouldn't necessarily be something that I'm metabolizing and excreting, and that would indicate consumption, right? So definitely something that I want to explore. So that's a great question.
Also, from a nutritionist standpoint, have you seen that it's better to eat organic, non-GMO products for your body, or is there not really in-depth research about like the effects of them?
There's certainly a lot of research that supports a more organic type of diet without pesticides or added preservatives can promote a healthier lifestyle. But also, there are plenty of food products out there now that are stamped with organic or non-GMO, and they just simply are not good foods to eat anyway. They're still processed. So it's a very complex question what you're asking. Generally, if you're eating just a whole foods more type of diet and you're staying away from the things that are packaged as best you can, then you will see improvement in your health. You'll sleep better, you will feel better throughout the day. There's definitely no question about that. But it's certainly complicated when it gets down to, okay, well, I'm eating, I've two stalks of celery. One is conventional and one is organic. Is this actually, which one is going to be healthier? And when you think about it in terms of cost as well, there are plenty of people who just simply can't afford organic produce. And I know there are a lot of organizations out there who are trying to mitigate that type of financial burden and bring more organic foods into food deserted communities. But it's still a struggle. So I would say that it's complicated, but I thank you for that question. And it's definitely something that I think we need to explore more in terms of research and really do some more clinical studies and see over time if the conventional way of eating with pesticides and GMOs and all that is really leaving a long-term impact, because that's what it really is. It's long-term.
Thank you.